Thanks, Doug. And yeah, they're being mean to you guys. I saved a chemist towards the end of the day here, but I'll try to keep things brief and keep the chemical structures to a minimum. So yeah, I'm Cameron Pye, co-founder and CEO of Unnatural Products. Salacious name in Santa Cruz, but I promise we're doing good work. So yeah, we're tackling this kind of core problem in drug discovery, and that's the great work that David Hausler and Deemer and Josh Stewart have been doing up at UCSC, enumerating all of the disease pathways we'd like to drug. We don't have a lot of drugs that can actually go and tackle those. So what do I mean by that? I mean that a lot of our drugs are either too small, like small molecules, these are the Lipitor's of the world, and they can go anywhere in your body, be orally bioavailable, but they can only act on targets that want to bind small molecules. On the other side of the spectrum, we have the things that are too big. These are the biologics, immuno-oncology therapies that are making a lot of splash these days, doing things that small molecules could never do. But because of their size, they have to be injected, they can never be orally bioavailable, and they can only act on targets that are on the outside of our cells. So what that leaves is this vast majority of biology that we know about that requires a large molecule inside of a cell. But luckily, nature has been working on this problem longer than we have, and she's come up with some crafty solutions that she has wanted to do. And the one that we're the most excited about at Unnatural Products is a particular chemical class of compounds called macrocycles. As that name might suggest, these are large, ring-like structures that are bigger than those Lipitor's of the world, but they can kind of hide their molecular bulk and slip inside of your cells and even be orally bioavailable. So we've been making use of these types of compounds as therapeutics for some time. This is cyclosporin up on the screen here. It's an immunosuppressive. They give it to you if you have an organ transplant so you don't reject that. But to date, we've had to rely on serendipity. We've had to find a molecule that nature happened to evolve to do something that probably wasn't suppress your immune system for organ transplants, and then get lucky that actually works in human disease. So what we'd really like to do is be able to design these things from the ground up. And that's what we're working on at Unnatural Products. My co-founder Josh Schwackman and I both did our PhDs up at UCSC in the chemistry department, the lab of Dr. Scott Loki up there, where we had the great fortune to be under his tutelage studying these macrocycles, asking some ivory tower questions. Hey, can we unpack those cyclosporins of the world, figure out what makes them tick, and then design that in synthetic systems? And towards the end of our PhDs, we kind of realized that yes, we could do that, and so it was time to actually go out and apply that and make some of these drugs that have been off limits to medicinal chemistry for so long. We have a great team of advisors, so which local, like Ahmed Hamdi and Seth Rubin up at UCSC, some of which are not, and then should point out that pretty much all of our academic work was funded by pharmaceutical companies. So we had this kind of interesting and unique opportunity where we knew what pharma knew about the space and what still needed answering. What we actually do is we take a hit macrocycle that binds one of its targets of interest, and through a combination of in silico tools like machine learning and other heuristics that we apply, we predict which molecules and modifications we can make to that would be better and more drug-like. We then go into the lab and actually translate those things into drugs on the order of hundreds to even thousands of compounds in as little as a week, test those in biological assays, and then hopefully arrive at something that's what's called lead-like or drug-like and has a chance of actually going into the clinic, which has really been the challenge in this case. We're applying this to some of the heavy hitters, the high-hanging fruit that have been on the chopping block for a long time. Various acronyms like MDM2 and P53 will mean something to some of the people in this crowd. Some of our other targets that we're working on are undisclosed, but also kind of in that ballpark. And we're already through to cell models on some of these things, looking to be in animal models in the next couple of months to have here. All right, we just raised some funding, just close to $6.25 million seed round, and we're hiring. So we're looking a lot for full stack developers, machine learning, and other data science folks, and would love to hire locally. So if you guys are interested, please come find me or my co-founder and talk more.